Hello, I'm Stephanie from Leeds Hypnobirthing, and today, with the imminent arrival of the royal baby, I thought it would be the perfect time to speak to you about estimated due dates. Notice I said the word estimate. The calculation for working out your due date is not particularly accurate. It isn't an exact science, and what I wanted to do today was talk you through how that's worked out. So it's based upon a calculation from the 1850s, and it works on the assumption that the average pregnancy length is 280 days from the first day of your last period. So it also requires you to know the first day of your last period. It works on the assumption that your cycle is 28 days, which isn't the case for all women. And it also works on the assumption that you ovulate on the 14th day of that cycle. So as you can see, there are a number of variables there that can affect the accuracy of your date. The other way that we do it is based upon an ultrasound. Now that is more accurate, and it gives you a date within 3 to 5 days, and it's based upon the development of the baby. But the other thing to bear in mind is that the gestation period, so the period that a woman is pregnant for, can vary, and it can vary from 37 weeks all the way up to 42 weeks. That's the period that the World Health Organization says is a normal period for a pregnancy length. So you can see there are really a number of variables that can affect when you actually give birth to your baby. What you'll find when you are pregnant is that as your estimated due date comes up, well-meaning family and friends will start to text you and ask you if there are any signs of the baby appearing. Now that kind of questioning, plus pressure from yourself, can put you into a state of low-level stress. And when we're in a state of stress, our body releases a hormone called adrenaline, even if it's a low level, and that hormone can affect the onset of labour, so it can delay the start. So what you want to do is make that period as relaxed as possible, reduce any stress, and my recommendation to you would be to do similar to what the Duchess of Cambridge did. So give an estimated due month, or tell people the date which is 2 weeks past your estimated due date. So your date at 42 weeks, and by doing that you give yourself and the baby some breathing space to make sure that you're keeping those stress levels as low as possible. You will also find that your medical team start to talk to you about induction as you come up to your estimated due date, and my recommendation to you would be to take a step back and use the BRAIN acronym to make sure that you have the information to make an informed choice. And that acronym stands for benefits, risks, alternatives, intuition, and doing nothing. And that gives you a few things to chat through with your medical team to see what's the best course of action for you and your baby. The other thing I would say is, remember, your baby and your body have known exactly what to do all over the last 9 months, and they know when the baby should be born, and unless there's a medical reason for bringing forward that date, I would recommend to just relax and let nature take its course. So all that remains to be said really is you won't be pregnant forever. I promise your baby will definitely come. So relax, just enjoy this really special part of your pregnancy, safe in the knowledge that your baby will arrive when they're ready.